My name is Dr. Ghazala Shaikh, and today I am here to share with you some of the tips on caregiving. Can you tell me what's caregiving, or why this concept is more important that I need to discuss on this?
At certain stage,
Yeah.
person, maybe because of illness, maybe because of age, maybe because of certain trauma,
Yeah, very good.
becomes incapacitated to look after himself
Very good.
and may need the help of
Someone else to
help.
provide care.
And that
Exactly.
person who is going to give help is a caregiver.
Yeah, it can be a family member, or nowadays you can get professional who can provide the job of caregiving. But today all of my slides are dedicated to the caregivers who are the family members. Most of the time they're elderly parents, because with an increasing aged population, caregiving is becoming a very important concept. So let's start. It deals with, as Sir explained very nicely, that it deals with impairment which related to, maybe it's because of the age, it may be because of some disease like stroke, maybe some mental disorder, some handicapped child, or elderly parent suffering from Alzheimer's or dementia or disability. All these things make a person incapable of taking care of himself, and there's the role of a job giver arises. It's a very challenging job, because the caregiver has to face a new issue every day. It's very important to be prepared for the role of a caregiver. My slides are basically provide you with some of the important concepts which can help you make in the right, which can help you to become a good caregiver, and at the same time avoid, how you can avoid the stress which arises while you are giving care to someone who is your family members. Basically most of the time it's your elderly parents, so it's become very difficult for you to balance your own need with that of the person you cared for, and if it's your family member, then you have that double strain of emotional trauma of that. So we must you must have seen the movie Piku. It was all about I was very much when I saw that movie, I was thinking how this girl can be helped, because we are into a sandwich generation now. Sandwich generation means you have your own kids to look after, and at the same time, because your parents are aging, they are having different disease, Alzheimer's, maybe stroke, they are getting disabled. So at the same time you have to look after your kids as well as your elderly parents. So caregiving becomes a very important role to play. Let's start. It's a challenging job. You have to take care of the disabled person's everyday needs. That involves toileting, taking care of the body hygiene, food, managing medication, to give them medicines on time, because most of the time they forget to take. Talking to the doctors and nurses on their behalf to communicate their day-to-day response and progress. Helping, as I said, their daily activities, you have to help them. Taking care, and apart from that, you have to look after the household jobs of preparing the food for them, and all the financial things you have to take care of. The first tip is, remember the person inside. Even if your elderly parents are not in a position, they are impaired now, but you should always keep in mind that the person they were before they become the patients. So you have to understand them physically as well as mentally, because aging is something which we can't avoid. So it's very important to remember that they are the same person you have loved, they are the same person who have showed love and affection, who has given you that same thing when you were young, and they were taking care of you. In this caregiver and patient relationship, the role of the adult is that of the caregiver. So it's become their responsibility to understand the need of the patient or their loved ones. Second tip is rethink personal boundaries. In this, you have to discuss the things which were, previously a very private matter, like toileting and the physical assistance needed by them. It's very important to be flexible and honest here. You have to start the conversation about it, that how, whom of the person in your family is going to take care of his toileting needs. You have to divide your work if you have large family, and it will make the thing easier, because it may happen that your parent is not comfortable with someone. So it's very important to start the conversation about his personal needs and who will provide which assistance. It's better to divide the work among the family. You have to be honest, candid, especially express what you can do and what you can't. If something, some people are very sensitive, they can't just take the responsibility of changing the diaper or cleaning the shit. So you have to be very specific what your caregiving job will be. And if you can't do it, just admit it and get the help from the outside. Most of the time I have seen, when two ladies, there was a conversation going between the two ladies, and especially if it's your in-laws, your sick mother-in-law who's got stroke and now bedridden, especially that time it becomes very difficult to, to discuss this thing, because in Indian society, mother-in-laws are always taken as a responsibility that the daughter-in-law has to take care of them. But I think it's injustice. The role of caregiving should be divided among both the all the siblings. Next thing is have patience. It's really a virtue in caregiving, because sometimes or most of the time, because of their illness, because of the frustration they have from the disease, if it's a cancer patient or if it's a stroke, all of a sudden the person who was functional get disabled. The person is under a kind of emotional trauma. Because of that, they may sometime give bad words or react very badly if you try. Yeah. So you have, at that time you have to show patience, you have to remove yourself from that situation, take deep breath and analyze their situation from outside, and then only you can respond to their needs in a better way. And this will help you to avoid the caregiver stress, because as you will keep on taking care of, because we are all human beings, and if we keep on hiding whatever emotional trauma we had while taking care of these sick people, it's somewhere it's accumulate in your brain and health, and it shows up in the form of stress or depression or anything. So patience is a very essential virtue in caregiving. The person who thinks that he is competent to have patience or understanding of that person's behavior should take the role of a caregiver. Trust. There should be a good relationship between the caregiver and the patient. Most of the time, if it's among the family members, it's already trust is there, but some people they trust one son or daughter more than other. It may be because of, if you are from a medical background, the people expect that you are the best person to taking care of. So you should always have that good relation between the patient and the caregiver. It will help you to understand their needs, and then only you can respond to their needs in a better way. Arm yourself with knowledge, because knowledge is power. The disease your patient or your loved one is suffering from, you need to know every detail of that situation or that disease. You can take help of the doctors online. There are many resources of information available for the specific disease and how to take care of them, and friends who have faced similar situation. all these will help you to become a good caregiver. And at the same time, if you will have more knowledge about the, the disease the person is suffering from, it will instill confidence in whatever thing you are doing, and at the same time you will become competent to take decision on behalf of your patient, and your patient will also feel more comfortable and relaxed that there is someone who can take competent and good decision for themselves. So they will become more compliant with the regime you have developed for them. Most of the time they become very aggressive, they don't listen what they are saying to them. That is, in that all situation you have to explain them that why you are doing this to them. Do it from your heart. As I said, caregiving is not a very it's not something that you have consented willingly for. It may be because there was no one else in the family to do this, you may have taken this job. So it becomes a job which you are not willing to do. But I think when you are doing it, just commit to it and do it from your heart, because whatever you do it from your heart, it becomes easier for you to do that. There is a wrong concept in our Indian society that taking care of the elderly is obligation. Most of the youngsters, they feel they become a source of stress for them. I think this is because we don't know, we are not yet developed ourselves for the role of the caregiving, and that's why I have chosen this topic for today's talk. So don't view it as an obligation. Try to do it something. It's a selfless act. It is the act of love. You are taking care of your own parents or your spouse or your handicapped child or anyone else who is suffering, who is not in a state to take care of himself, who is physically impaired. You should feel good about yourself that your action or your job is going to have a positive impact on the life of another. So try to do it from your heart and try to do it happily. Humility, then again it's a very difficult thing, but even if they are elderly because of the disease, because of the cerebral atrophy, because of Alzheimer, dementia, they are not able to take care of themselves, they don't know what they are saying. In all these situations you have to practice humility, because after all they are also human beings. Just try to accept them as individual human being just before they become the patients. So don't disregard their opinion. If they express their need or if they express their opinion, still there is a lot of lessons which you can learn from your elderly parents. So if they say something or if they give opinion about anything, just listen to them, give consideration to their point of view as well. And if you find that what they are saying or what request they made is not possible for you to do right now, you can explain them, but let them know that you heard them, because if you will ignore them, you are going to face a new trouble. They will get angry and the trust and the mutual relationship will become bad. So it's very important to respond to them. It's not I'm not saying that you have to jump every time your parent call, but yeah, try to make them independent as much as they can, but at the same time you have to show them that you consider their point of view, you still respect their individuality. Being humble means recognizing that we are not on earth to see how important we can become, but to see how much difference we can make in the lives of others. So this is very important in taking care of the elderly parents. Look for non-verbal cues, the body language, the tone of their voice, or look into their eyes and try to analyze what exactly they are asking for. Be responsive with limits and never try to ignore their needs. Let them know that you heard them and you are going to consider their point of view also in taking any decision with regard to their health. Be present. Spend some quality time with them. Try to enjoy their company. As the picture shows, if they like reading, just read some books or some good story with them. It will help them to realize that they are still important in your life. Be non-judgmental. Again, getting old is not easy to accept. Even we would not like to accept that we are getting aged. So you have to accept that aging, it makes them also feel very frustrated. Even I personally, from my personal experience, I can say that it becomes very difficult to accept that, when you are taking care of your parents and they don't listen to you when we are guiding them. It is because even if they become patients, they still want to be independent. They still want to, take control of their own life. So I think it's better to accept that, that freedom that they are asking for, and try to help them when you really feel that they need your help. Unnecessary, if we keep on, giving care or giving help to them, it is also going to hamper their recovery process. So for this you need to develop tolerance and be non-judgment about them. Communicate with touch. It is also very important in caregiving. A hug, a pat on arm, or just holding hands can make a much big difference. Last is build teamwork. It's very important to have this attitude in your mind while giving care. You can have in your team your family members, your extended family, but it's very important to have healthcare professional into your team, the doctor, the nurses, if he is hospitalized, and if he is not, then you have to discuss with this team. You have to make a team which family member can do what things in the right manner, and accordingly if you will assign the job, then caregiving will become much easier. So always includes the healthcare professionals so as you can assess the prognosis of your loved ones. Trust yourself and make decision based on the situation and perform your role with confidence, because caregiving is nobody is a perfect caregiver. There is no rule book to make you a perfect caregiver. So you should always try to, and I think caregiving provides you a very good chance where you can redefine your relationships. Because if you detach yourself and if you start considering that person just as a human being, not as someone as my dad, or because when you get too personal, that time your expectation or your past memories of that associated with that person all arises, and then you become judgmental. So personally I have experienced that caregiving is a beautiful, I think say it is stressful, but at the same time it is an opportunity for us to redefine our relationship with our own parents or siblings or any of the family members. So at last, have the courage to do the best you can, and it's very important to seek help when you need it. Most of the time what happened that people keep on suffering being a caregiver, and that can leads to caregiver stress. So I hope my lecture today will make your life a little easier being a caregiver. Thank you very much.
Thank you. Good.
हाँ सर, अब बताइए क्या पूछना है.